If you're in your late 30s, your 40s, 50s, and beyond, and you suddenly feel like your body is unfamiliar, your energy, your sleep, your mood, your sex life, your skin, all of these things, and you have been told that your labs are normal, but you know something isn't right, this space is for you. Especially if you are a Black, queer, non-binary person and you've just learned to push through even though you knew something wasn't right. This space is especially for you. I'm Lorri Price. I am a family nurse practitioner and the founder of Vermae Telehealth, which is a virtual practice. I currently practice in 16 states with the 17th pending. And I specialize in hormonal and metabolic health care, especially for those in peri, post-menopause, who want answers and not dismissal. Okay? So if you have experienced brain fog, where you're word finding, all of us have, a lot of us have anyway, and or you walk into a room and you're like, why did I come in here? I don't even know why I'm here. Just more forgetful. Or if you feel like you've slept through the night, but you wake up in the morning and you're exhausted still, you're really tired. Or if you're waking up at 2 to 4 in the morning, can't get back to sleep. You're feeling wired but tired. Or if you're more moody, snapping at people. These things are all changes in your body and you're like, what is going on? Or your skin is just itchy. I mean, not mine now, but if your skin is just itchy for no reason, you're like, what is going on? When did this happen? Or you're having vaginal dryness, or you're just not attracted to your significant other anymore, and they ain't done nothing. Those could be hormonal and metabolic changes that you're experiencing that need to be addressed. And if you have gone to your primary care and they did a basic set of labs and came back to you and said, oh, those labs are normal, and you're still like, but I know something's not right. As I said, the space is for you. Basic labs typically are a comprehensive metabolic panel, which checks your blood sugar and kidney function, liver function, a CBC that checks your blood count and checks for any, blood disorders, anemia, things like that. Likely a TSH, which is thyroid stimulating hormone. Probably cholesterol. Those are typically what's ordered as basic labs. And you can get a lot of information from that, but you got to know how to be able to interpret it and tie it to the symptoms that are being reported. And so that is what I do. I do differently with my practice. I listen to my patients. I give them time to explain what they've been experiencing. And they end up sharing a lot of times the traumas that they have experienced in healthcare, which is unfortunate. And many of us as Black, queer people have experienced those. I have myself, even as a medical professional. And so being able to do what I do and really listen, and based on what I hear from my patients, being able to order a comprehensive lab panel to check and interpret these labs from a functional medicine lens really is what makes a difference in getting to the bottom of what's going on. And it's called a root cause analysis. It's not just prescribing a medication for your symptoms. It's finding out why you're having those symptoms. And even if my comprehensive lab panel I do isn't giving me all the information I need, I have the ability to offer even more advanced testing so that we can get to the bottom of it. And that does not mean that I don't refer people to specialists, because sometimes when I identify things that a specialist would be able to better manage, then I'm also capable of doing that in my licensed states. So it's Vermae Telehealth is complementary to your primary care. Primary care, there's a place for that. It is more based on reacting to different disease processes. And like I said, there's a place for that. But with functional medicine and the way I practice, it's more proactive in trying to prevent those chronic disease. And the way I explain it is that the lab panel I do can identify these smoldering fires, things that you don't see the fire, you might not even smell the smoke or see the smoke or anything like that. But I'm able to identify these things early so that they don't turn into these 4-alarm fires, which is chronic disease, which could include diabetes and high blood pressure and kidney failure and strokes and heart attacks and things like that. And so I intervene at that time so that we can hopefully steer you from developing those things. And it takes a little time. It's not a quick fix. And so what's needed, in addition to me being the provider and listening to you, letting you know what I see, giving you your treatment options, it takes a little work from you as well so that we can keep you as healthy as possible. And this is not dieting. And like I said, this is definitely not throwing medication at symptoms to take care of it that way, because in all reality, it does not take care of it. And so I look at things like your fasting insulin. I order that. That is one lab that is not typically ordered when primary care is looking for diabetes. They're going to check your fasting glucose and they'll check your hemoglobin A1C. And by the time those numbers start to be abnormal, you're already in pre-diabetes or diabetes even. But doing a fasting insulin is done to catch that early, because if your fasting insulin is elevated, that tells me how hard your body is working to keep your blood sugars normal. And without going into too much detail, if that is over a certain number, then of course we want to intervene and make some changes, some small changes, maybe even put you on some supplements to help your body be able to process glucose better. Also, another thing is thyroid function. Thyroid function it's significant. It plays a part in other hormone signaling, in your metabolism, just a lot of stuff. And that thyroid stimulating hormone is not an accurate reading or indication of what your thyroid is actually doing. You have to do the active thyroid hormone, which is free T3, and free T4, which converts into free T3. And so you want to have all of that information available to make a determination on how well your thyroid is functioning. Another thing that I check would be an HSCRP. That's a high sensitivity C-reactive protein, and it tells me about inflammation. There's a standard CRP that's done typically for people who have maybe an infection or an autoimmune disorder flare, or if they've had surgery or some type of trauma. But it also is one that indicates like a big fire. something huge. It's like a smoke alarm for a big fire. When the high sensitivity C-reactive protein is a reading that gives us the more subtle inflammation that's going on inside of your body. And so it also can indicate that you have an increased risk of cardiovascular disease if that's elevated. And so to treat that, we want to, start working on getting that inflammation controlled so that you don't have those increased risks. And that also can drive, weight loss resistance, brain fog, fatigue, joint pain, all of those things that you could be experiencing. And so that is another one that's not typically done, but I do that in my comprehensive lab panel that I order. Trying to think, another thing that I do is your cortisol level. If your cortisol pattern is not what it should be, then that can cause increased belly fat. That can cause you to have that wired but tired feeling, not be able to sleep well, for you to be waking up in the middle of the night and have, difficulty falling back to sleep if you do. Cortisol is our stress hormone. It's something that responds when we need to in that fight or flight mode, but it should not be elevated when we don't need it to be, but it can be when it's trying to protect our bodies. And that's what I teach my patients, is that a lot of these things that I find I'm able to identify isn't because they're doing anything wrong. It's just because your body is trying to protect itself. It's trying to keep you alive. And so when your body is under increased stress, or when your body is, and as especially in this day and age, we're under stress, especially as Black queer people, with racism and being mothers, fathers, sisters, or caretakers for our aging parents and grandparents, possibly for some of us, and spouses, and all of these things that we have to take care of. That stress can lead to some of these things too. And it's not that we're doing anything wrong, but your body is sensing all of these things and responding in a way to protect you, to keep you alive. And so when it's under increased stress, it's not going to let go of that additional weight, because it's trying to protect and preserve what you have. And so all of those things need to be looked at. But first, like I said, it takes listening to your patients and your clients, and that is exactly what I do. And I'm thankful again for having the opportunity to do this work. And so with that, I do the Beyond Normal Labs visit, which kind of guides me as to what the patient is needing to feel better in their body. Consists of a couple of visits, one where I listen to you, have an hour-long visit, go over everything that you've been experiencing, symptoms, history, family history, things you've tried, the way you're feeling, your life, your lived experiences. And then I order that lab panel based on that. And a lot of times I'm already knowing what I'm going to see when I get the lab panel back. But not always. Sometimes I'm surprised by things, but that's why I keep digging and don't give up until we find what's going on and get you a resolution. And so after the lab panel is returned, I review that. I come up with a full detailed metabolic and hormonal alignment map for you. And that next visit that we have, I go over that in detail and also present you with that. And based on those things, then we determine, the two of us together, not me telling you what you need to do, but I tell you what things I recommend, and then you decide what it is you want to do to resolve the things that I have identified from your lab work. And it goes in phases, because like I said, this stuff did not happen overnight, and I would hope no one expects that we're going to fix it overnight. I ask patients to commit to working with me for 3 months for sure. 6 months is ideal because that is when we notice the most changes and the most improvement. And then after we have reached your goals and taken care of these things, we repeat labs during that time. We meet regularly during that time. During that time, you have access to me to be able to contact me so that we can see how things are working for you. And so I work with you and help you be able to work with your body. And that's based on what your body has been telling you over this, whatever amount of time you've been trying to get answers for whatever has been concerning for you. And so, again, that may include, some supplements, that may include some subtle, changes that we make, tweaking a few things that you're doing. But it's individualized care, just so you know that it's not a generic one size fits all approach, because that's not how you care for people. And that is why I take this approach and start with labs so that I know where we are and what we need to work with, okay? So who this care is for, as I said in the beginning, it's for everybody. However, I specialize in caring for Black queer folks in their health journey, people who are ready to invest in their care and who are willing to work with me, those who are in my licensed states, people who have felt dismissed, people who want answers, people who want the data and want it explained to them and not just said, oh yeah, it's normal. People who want to feel comfortable with asking questions, and people who don't walk away with like, yeah, I don't know what just happened. All I know is they said it was normal, but I don't know what that means. What does that mean for me? We talk about reference ranges. We talk about what's optimal for you. Reference ranges don't include everybody. And I explain that to you in your visit, how reference ranges are, how they come up with that. As I said, if this, is something that you're interested in, and that's getting answers and not feeling dismissed, then I would hope that you subscribe to my channel. I will be doing weekly visits, weekly videos, and I do weekly visits too. And that if you'd like to move forward with learning more about my practice or getting more information, I will put the link in the description. And like I said, you can start out with a clarity call with me. If you're not sure of what you need or what you want, I'm available to talk you through that and give you the answers that you need before making a decision. Yeah. And so I, again, want to thank you for listening for this 18 minutes. Some videos will be longer, some videos will be shorter, but I look forward to educating and caring for those who are in need of my services. And I want to wish everybody a Happy New Year, because today is December 31st of 2025. And I look forward to teaching, seeing, listening, and guiding. Have a great day.